growing pressure to contain the deadly outbreak. Meanwhile, health authorities across the continent have been stepping up surveillance and other precautions to prevent a repeat of the disruptions and deaths during the 2003 SARS crisis. Now, later this Wednesday, representatives from China and other countries affected by the disease are expected to attend an emergency meeting.
With the number of confirmed cases creeping up, a belts and braces approach is being firmly enforced in the birthplace of the deadly coronavirus. In the central city of Wuhan, health officials have been zipping into their protective gear to treat and test locals who flocked to clinics. While at the railway station, mask-wearing staff remain glued to these screens, which can detect if any passengers have an abnormal temperature. China's Health Commission says public spaces and transport hubs will now be disinfected and better ventilated, with the virus set.
And with that, it's more the same kind of what we've been hearing, but I wanted you to hear something a little different here. Let me throw it on.
This in perspective, we are in the middle of the influenza season, and we're talking here about the virus that has caused 9 deaths among 440 cases that have been actively sought. That is not that different, actually, from the regular, everyday, every year seasonal influenza. So this is very different from SARS. So far, we don't have any indication that this would be a highly pathogenic virus.
SARS, of course, the virus in 2002, which did claim many lives. This is a new strain, not previously to have been identified in humans. How difficult will it be from a perspective of health security to monitor passengers?
And he's going to talk about what they're doing in security airports and stuff, like in Russia, and what they've started to do. If you've seen my previous videos where the CDC was saying they're setting it up in New York and they're setting it up in different airports now for screening and stuff. This guy cuts through the chase and says that that's really not even going to be effective. That we need to be putting money basically in hospitals and getting ready for this, because you're not going to stop what's coming that way. But I want you to hear it from a professional.
Just coming into Europe who could be infected with it.
Well, to be honest, I'm a bit surprised that so many countries have gone to this. WHO is the World Health Organization is very clear in their recommendations that this is not very helpful. And the reasons are that it's actually impossible to catch everyone in the connected society that we have nowadays. Most people will not show symptoms when they are exposed immediately. So this is a bit more show than actual effect. I would put my emphasis on strengthening healthcare services and the preparedness.
So in case you didn't hear what he said that you can't basically catch everybody at the airport. It's ineffective. And what he talked about was the incubation period, which I've talked to you guys about, which is now anywhere from a few days to 15 days before you even show. And again, maybe you're a carrier where you hardly get it, or you may not have things that show at all. So we'll hear a couple more minutes and then I'll tap out.
It's there so that you can actually detect the cases and get them into treatment and isolation if necessary.
So you've just heard our correspondent in Moscow. You think the procedures that they're putting in Moscow airport then are almost futile?
In the long run, I think if it's so that this is really easily transmissible, it's probably futile, because all previous studies and also modeling shows that you can maybe push the start of the outbreak in different settings with a couple of days or perhaps weeks, but that's about it. So the resources would be better spent in preparing the healthcare sector for whatever is coming.
And he repeated himself again. He said that basically it's futile. Resistance is futile. All joking apart, so it's for show, is what he said. That's why they're doing this at the airport. They're doing that, but to get ready at the hospitals, because this could be coming big and fast. And they keep going back and forth to other disease that we've had in the past. The SARS, the other plague that came from China a few years ago. And then my other video, I talked about Mars, another Middle East problem we had over there. So I'm just trying to get you guys out in front of the ball to see what's coming. Again, wash your hands. Don't be afraid to wear one of those masks. Do what you have to do, protect you and your family. If this thing gets out, carried away, and you start seeing city to city to city, most of us have talked about those kind of scenarios. And what I would suggest, once you think it's full blown and just if this gets out of hand, then you go buy your food and stuff, put a mask on if you're out in public, get some stuff, try not to go out any more than you have to. Because when you are out in public, if this thing goes awry, that's when you bring it home, you spread it in your family. And, again, treatments of this thing, when you're talking about, they were talking about 2,500 in one case of the disease, I think it was SARS, 800 deaths. That's a third, basically, or, you know what I mean, or between a third and a fourth of deaths. That's a lot of deaths, guys. They don't talk about treatments and stuff. And I can tell you, people with weak immune systems, children, and elderly definitely need to watch out. So I'll let you finish off.
Whatever is coming is clearly what people are trying to anticipate and also limit as well. If people are traveling, particularly through China, what precautions should they be taking?
Yeah, I think the important things is to take care of good personal hand and respiratory hygiene. So frequent washing of hands. I think it's still pertinent to avoid some of the market settings, although I think we are past that stage because there's more and more evidence that there's community transmission. But keeping hands clean, avoiding very crowded situations if you can, which may be difficult in this setting, I think is the best advice.
Thank you very much for your analysis.
So he kind of covered what I just told you guys, basically. Healthcare is kind of what I do, and I've done for a long time. And, this is not to scare anybody. This is just so you guys be prepared, man. Like what he just said, what I've been preaching about is wash your hands. Maybe he didn't say wear the mask, but I'm saying it. If you're out there trying to stay away from mega people, going to a store to get your groceries, like I just discussed, you're going to have to be careful. Going to hospitals, going to any kind of air travel, you're at risk now, guys. Because if I was a gambling man, I'd already say there's above a good 20-30% chance that it's already in the airports, guys. When it's in Seattle, I'm in Oregon. Seattle, that's pretty close, guys. And a lot of Asian people travel through there. There's going to be a lot of this in Vegas eventually. A lot of things go on there. California, New York. And then this is going to travel in between. And again, refer to 12 Monkeys, guys. And with that, remember, healthcare sucks. Over and out.